The All-in-One Medicare Show, hosted by Charles Vasquez and Nick Basto. All-in-One Benefits Group provides you with the right resources for your business. Charles and Nick will help you get ready to sell clientele management and stay in the know with insurance plans, policies, and procedures. On to the show.
Hello, live. This is Charles Vasquez, Medicare. What's the name? What?
All-in-One.
All-in-One Medicare. So this is our first show that we are doing together.
And this is Nicholas Basto.
Yes, so I am Charles, and we have here Nicholas Basto, and we're going to be talking about some of the major key points regarding Medicare Advantage, and some of the interesting stuff that I think that would be interesting for you guys. So first of all, thank you for tagging along and watching this. This is awesome. This is a heck of an experience for us, and we definitely want to thank Donna and Freddie for having us on here, and this is going to be amazing. Obviously, to start off, before we get into the nitty-gritty and talk about some of these good things, these great benefits and Medicare, we want to kind of give you a background on who we are, and where we come from, and what we do and how we do it, which is super important for you guys to know who we are, because we want to be known in the community, and it's that's really, really important. So obviously, my name is Charles Vasquez. This is Nick Basto, and we've been in the business for how long? How long we've been doing this for?
3 years now.
Yeah. So we've been doing this for 3 years, and let's kind of get into how do we meet? Yeah, for sure.
So we come from a baseball background. Our whole lives it was baseball morning, baseball for lunch, and baseball for dinner. That's all we did: ate, sleep, and ate baseball. So
for sure.
We know each other from a very young age,
live on Instagram?
And it's been an awesome ride. For example,
we live on Instagram.
We started playing, travel ball together from a young age, traveling around the country, meeting new people, playing a lot of tournaments and things like that. And then we ended up going into the high school realm together and playing ball there as well. And that was an unbelievable ride as well. And then from there, Charles, he'll let you know when he talks, he went straight to college right after high school, but I went through the professional route. Got drafted actually by the Chicago White Sox right out of high school. So I played for 7 years in the minor leagues. And then from there came back after 7 years and then got into this Medicare, what we're doing now, which is the All-in-One Benefits Group. And then Charles can talk about
For sure. So I had a little bit of a different route than Nicholas. Nicholas, listen, this guy was a beast in high school. That's just, he got the opportunity to play out of high school. Unfortunately, I didn't. I ended up playing professional baseball, but I did go to college first. I went to Lipscomb University in Nashville, Tennessee. It's a small little mid-major D1. So I played for 2 years there. Very fortunate to play 2 years of baseball there. And unfortunately, things didn't work out too well when I did play in the minor leagues. I was able to get picked up by the New York Yankees, and I had some fun, honestly speaking. I had a great time. It was a great experience. I got to travel the country, meet a lot of different people from different ethnic backgrounds, from Dominican Republic, Venezuela, all around the world, Cuba. So, the competition is really good. But yeah, didn't work out too well for me. So I ended up, getting into the medical field. Working as an insurance agent, and I did it for a couple years. It was fun. I ended up hitting some good numbers, and I basically converted into being an agent to kind of doing this thing with Nicholas with the agency, because we wanted to be able to not only inform the community properly about some of these things, but we wanted to also teach other agents how to inform properly, because a lot of the things that we're seeing is misinformation regarding the plans, regarding what Medicare is just in general. So that's basically how that is.
And when we partnered up, there was a huge need that we saw real quick in the community, that people were getting bombarded with information that they didn't know how to, speculate on. They didn't understand it. So we saw from a real, from the beginning when we started this, that there was a huge need and the help was tremendous. And that's why we jumped in, because we're getting calls every day and they just don't understand what to do, what steps they need to take for their Medicare. And I mean, this is a big deal because there's a lot of things that you can get covered with Medicare and things you don't get covered. So there's a huge need of information that's out there that people still don't understand. And that's where we grouped up and got into this.
For sure. And we get a kick out of this. I mean, shoot, we're helping people, you know, that have a need, and we're doing it for them for free. There's no charge in any of this. We tell our clients all the time, you know, if you have a question, just ask us. You know, we're always willing to help. We're very flexible.
It's funny you said that because I had a client the other day tell me, hey, you know, how much is it going to cost for me to talk to you? I said, no, this doesn't cost anything. This is for free. I'm here to help you out. I'm not going to charge you anything.
That's so funny. You know what? One time I had a client gave me $100, you know, just for her help, and I was like, no, I don't want to take it, you know. And she was like, no, take it, put it in your pocket, this and that. Like, you came all the way to my house to help me, and you helped me save so much money for my insurance policy. I said, I really appreciate it. Thank you so much. I cannot take this, you know. Unfortunately,
it made me feel uncomfortable.
But you know what though? It makes us feel good though, because we're providing a need to the community.
And yeah, that's one of the main reasons why I'm in this too, like yourself. I mean, from just going back to the baseball world, one of the biggest things I learned playing was just sacrifice, you know, putting yourself not first, you know, putting your team before you, and there's a huge need, you know. In the baseball world, you have to put your teammates before you in some situations to win and execute a ball game. So that's one of the biggest things that I learned playing. Putting my teammates before myself, and just how that example you had right now. There's some clients that, I mean, they'll call you for anything. It's like you just see the need.
You're absolutely
on
right.
a daily basis, and we're just putting them before us in these situations to help them out with whatever they're going with.
Well, apart from that, Nick, what would you say, you know, are some of the things that you brought structurally in the minor leagues, you know, that is helping you today? You know, I know you mentioned working as a team, you know, and mentioning these great qualities. You know, would you say that becoming a baseball player actually helped you, you know, becoming an insurance agent in this world? Is that?
Absolutely. Yeah, I mean, just the communication with your teammates, you know, communicating, getting things and information done quickly.
Absolutely.
You know, a lot of these people in the Medicare world, they need to know that they need to apply for, you know, their Part B fast, because, you know, if not, then they'll get a penalty. So communication is key.
For sure.
Like I said, sacrifice, you know, putting themselves before us.
Absolutely.
You know, answering phone calls. A lot of these clients or people with Medicare out there, they don't have no one to talk to. So
absolutely,
I let my clients know, you know, call me. I'm here to help you. I answer all my phone calls, and if I don't answer, I'll get back to you real fast.
That's awesome. That's awesome. Well, I think we're going to start getting right into the nitty-gritty and start talking about, you know, some of the things about Medicare. But, you know, I do want to give a shout out to Movies of Delray and Movies of Lake Worth. They're going to be doing a nice little movie theater event where you guys can, you know, go into the community and watch a movie there. All in One Benefits Group, you know, obviously wants to partake in this event. So we just want to let you guys know ahead of time. If you guys have any questions regarding, you know, planning for your health insurance, you know, for the future, let us know. We're going to be out there, and we're going to be giving out 2 free movie tickets to random people that call. It's going to be, you know, like a little raffle. We're going to be jotting down names that people that call for this benefit and be a lucky winner.
And
we're
again,
going to select
free
2
of
people.
charge. We don't charge anything to talk to you. We're here to help.
Absolutely. So now let's kind of get into it. We're going to be talking about, like we talked about, original Medicare versus Medicare Advantage, and what are the pros on choosing Medicare Advantage. I think one of the biggest things that we can say regarding Medicare Advantage is the maximum out of pocket, which is huge. Do you want to get into detail what, you know, the maximum out of pocket is, Nicholas? What can you say about the maximum out of pocket versus original Medicare and Medicare Advantage?
So there's the maximum out of pocket on most of these Medicare Advantage plans. You could see some up to only $1,000, which is unbelievable.
Which is, absolutely.
And then you have other plans that go up to $2,000, $2,500, $3,500, which is not much. But like I said from the beginning, $1,000. There's a plan out there right now that's offering that. Which is unbelievable.
Yeah, that's in a worst case scenario event. So what that basically means is that if you have a maximum out of pocket for your policy that is $1,000, the most that you have to come out of your pocket is $1,000. Versus if you were in original Medicare, you don't have a maximum out of pocket. So you can start to see how it gets expensive. For example, if you have to do chemotherapy, that 20% that you're entitled to, you don't have a limit. You're going to continue to pay 20% for your chemotherapy, unfortunately, until you finish. With Medicare Advantage, it's not like that. As soon as you come out of pocket $1,000, everything else is for free.
So we really encourage the people that we talk to that are only on, straight Medicare is what they would probably say is
Correct.
that, hey, let us sit down with you. Let us show you these opportunities and plans that you have that will help you out, cover cost, and not only that, give unbelievable benefits. And every year they're changing. They're adapting every year, and there's plans that are super competitive that have
For sure.
unreal benefits.
Absolutely. And maybe we jumped the gun a little bit here as far as talking about the maximum out of pocket, but maybe we should also talk about the difference between original Medicare. So there's various types of ways on how to get your Medicare. You can either get it traditionally through the federal government, you can get it through a private insurance company, or you can get a supplement. A supplement, we're going to talk about that at on another show. Probably later this week, but we're just going to get into like I said, the nitty gritty of what original Medicare is. So original Medicare, you have what's called the Part A. The Part A can be free if you pay or incorporate 10 years of taxes, and it's also relative to your income. So if you make higher than a certain threshold, your Medicare Part A can actually have a premium. You also have your Part B. The Part B is the medical coverage. The Part A is the hospital coverage. Part A, hospital, hospice, skilled nursing facility. The Part B is the medical,
DME.
the
so that's kind of
durable
like
medical equipment.
people who are dealing with, for example, COPD, chronic, lung disease. You need these equipments like breathing machines, or people that are bound to a wheelchair.
Correct.
There's companies out there that will help cover those costs for those DME equipment.
Correct. And that's covered under the Part B. Now, the one thing about original Medicare that I will have to say is that their prescription drug coverage has to be purchased standalone through a private insurance company. So you don't get that with original Medicare. Another thing that you don't get with original Medicare is
Part C.
is your vision coverage, your dental coverage, and what's called your Part C, Medicare Advantage. That's another option that you can take. That is the option we actually recommend. And,
always.
why would you say Medicare Advantage, or in other words, Part C is the way to go? What are some of the things that make it,
Absolutely.
the it factor?
Well, like you said, coverage. I mean, that's one of the biggest things. You want to have coverage because, God forbid, you fall into the hospital. If you just have original Medicare, your Part A covers 80%. You have to take care of that 20%. So, for example, a $100,000 bill, yeah, your Part A will cover $80,000, but you have to cover those $20,000 that are left on that bill. So if you're on Medicare Advantage, whether it's an HMO or a PPO or a Medicare supplement, we recommend those plans because it will help cover those costs. For example, there's a plan that has a $1,000 maximum out of pocket. So if you have a $100,000 bill, the maximum you will pay is just $1,000. And then on top of that, like you said, you can get dental, vision, hearing, and prescription drug coverage all in one plan. Which
would that cost anything extra?
No. So as long as you're paying for your Medicare, which is the $164.90, you can get those supplemental plans that are free. There's no monthly premium or deductible.
Absolutely. One thing you mentioned, Nicholas, that is kind of important. I don't know, maybe you guys can ask us or let us know when, with the phone call. Are you guys familiar with the difference between an HMO and a PPO is? That's a big thing that people want to know. You know what? Why don't we talk about that? After we're going to be doing a commercial break, and we're going to get back to you guys and let you know what the difference between an HMO and a PPO is.
Sounds
okay,
good.
guys, we'll be right back.
See you guys soon.
Are you compromising your medical care for doctors out of your network? Are you tired of dealing with referrals to see a specialist? Are you aware that you can save up to $155 a month on your Medicare premiums? You need an all-in-one benefits company that can help with all of your Medicare plan needs. Call today, All-in-One Benefits Group at 954-614-5488. We're here to find an all-in-one plan for you. 954-614-5488. Call today for open enrollment.
You've been watching the All-in-One Medicare Show with your hosts, Charles and Nick. If you'd like to get into contact with All-in-One Benefits Group, contact 954-614-5488. Now back to the show.
Welcome back.
Welcome
guys,
back.
from our commercial break. We're going to get back into what we were talking about regarding the HMO
And the PPO.
Man, this is, I just can't stop thinking about this, experience. I'm sorry to kind of get off the subject here, but my goodness, what a beautiful studio. Wow, Nicholas.
No, it really is. With all these paintings and things around us is unbelievable.
How do we get the opportunity to fall upon this? How did that come about?
So Joey from Cafe News,
That's right.
came by to us and said, hey, we have this place that you can go and record live and talk about the things you do. And I said, sure, let's check it out. And then we came once and we met Freddie and Don from the Brooklyn Cafe Show, and we're here now.
Absolutely. Well, first of all, Joey from Coffee News, thank you for the recommendation.
Yeah, shout out to Joey.
This is really a heck of an experience, something that I never thought that we would be able to be here.
Yeah, especially doing it live.
Awesome. Yes, absolutely. The best contact number to reach us, Nicholas, what's our
Yeah,
contact?
so if you have any questions, please contact us at 954-614-5488. I'll repeat that again, 954-614-5488. And remember, we don't charge anything. Call us if you have any questions, even if it's just a simple question. We're here to help.
Yeah.
And then we also have the website and email that you can check us out
Oh
at.
yeah, absolutely. You can guys also contact us on our email at admin@allinOnebenefits.com. We're also on Instagram, All-in-One Benefits Group on Instagram, All-in-One Benefits Group on Facebook. We also have a LinkedIn as well. So please make sure you check that out. Leave us a comment. Any questions that you guys have, you can call us or comment in the section there. So we greatly appreciate that. So let's get back to what an HMO or a PPO is. Nicholas, how you want to go first?
So well, I was going to ask you, when you're sitting down with a client, because there's so many good benefits that have come out for the new year, what do you recommend, or what would you say the differences between an HMO and a PPO?
That's a great question, and it's really, really important for you guys to know the difference, because it's all about how you want your care. Convenience versus financial, and that does matter. So I want to make sure that you guys understand what is the difference. So I'll start off with an HMO. An HMO is a network-based insurance or policy where you can get care. So you do have to choose a primary doctor, so that we know, and you have to get a referral to see a specialist. So if you want to go see a cardiologist, for example, or a urologist, for whatever reason, neurology, you have to go see your primary doctor, talk to your doctor. Hey, doc, I'm having these issues, whatever the issue that I'm having, and your doctor is going to give you what's called a referral, a reference to that specialty. That is what a HMO is. It's a network-based, and the reason why it's network-based is to bring down cost. So it's very important if you want to get a insurance policy that's going to be cheap as possible. Now, what is a PPO? A PPO is the more expensive, I guess, alternative. And why is it more expensive? Well, first of all, it's not going to cost you anything extra. I do want to make that a point. Having a PPO costs $0 extra. What makes it more expensive? Well, the copays are higher. Okay. Why are the copays higher? Well, it's not a network base. Now you can actually go see your cardiologist, your urologist without a specialist. So what?
A referral, yeah. You don't need a referral.
You go directly to your specialist and say, hey, doc, I have this issue with my heart. I take losartan, I take some type of statin, and I need some type of help or some type of way to regulate myself. And you don't need to see a private. And why is that important? A lot of people ask, oh, I like having a referral. Well, if you're going through an urgent situation and you need to go see your doctor, it's going to take you about a week or two to see a primary doctor. It's going to take you another week or two just to make that appointment with the specialist. It can take you about as much as a month to a month and a half just to see a specialist. If you guys have a PPO, you guys go right away to see the specialist, no problems, and it's as easy as that.
There's definitely pros and cons to both plans. For example, on the HMO side, we know that the benefits are way higher than the PPO side. For example, on the dental, vision, and hearing benefits, you can have up to $4,000 on a plan in an HMO for dental.
Wow, 4,000?
Which can cover implants, root canals, extractions. I mean, these are amazing things that people are getting covered in the HMO world.
And I'm pretty sure you have to buy those policies separate if you were on original Medicare, where in a case
Correct.
like this, like Nicholas just said, you guys are
It's
getting
baked
that covered
all in one plan.
all into one plan at zero cost extra.
It just depends on the carrier too. Many carriers fluctuate on benefits, but we have them all. We're brokers,
Absolutely.
so we have all the carriers. We don't just try to sell one plan. You know, we look for the client's needs, and then we go from there.
And we're going to also do another show where we're going to be actually talking about the benefits for each company. So I do want to let you guys know that we are contracted with all carriers, the Aetnas, the United Healthcares,
Humana.
Care Plus,
United.
anybody you can really think of. We are contracted with them. There's no incentive for us to say, hey, choose this. It's all about what your needs are, what you need, how can we find the solution and the answer to serve those needs. So that's really, really important. You know, you got to make sure that you have somebody that's flexible to give you what you need. A lot of people are like, get this, get this, get this, get this. No, don't get this.
Yeah, you have people out there bombarding you with mail and spam phone calls and all these crazy stuff. But like I said, when we meet with you, we're listening to your needs. We're not here to sell you one plan or focus on one thing. There's many people that can only sell one plan, but we're individual brokers, so we have all the carriers. We're going to look at your needs, and then we'll go from there. We're not going to stick to just one plan.
What do you think as far as bringing up the subject? I don't know if we want to bring it up here regarding the food distribution. The secret, we might review that now, we might review it later. What do you think about that, Nick? Should we
Yeah, we can talk about it now.
Okay. So basically, we are going to be talking about a food distribution with a company that we work
Closely
with. You know, we don't work for them. We're not affiliated with them whatsoever. We just work very good. It's a good partnership that we created. We're going to be doing this food drive. Now, this food drive is a great opportunity for you guys to go into the center to get healthy food. A lot of the times, these Medicare Advantage plans are only out there giving benefits for food to the medically needy. Not medically needy, financially needy.
Someone who has Medicare or Medicaid, they can qualify for
Correct.
some plans that give food every month.
Correct.
But like you're saying, these food drives, this is something awesome for people that don't have Medicaid. They can,
Absolutely.
you know, a provider can help out and provide those needs for those people that are in, you know, they don't have the money for food every month.
Absolutely, and don't worry about the location. We're located all in we're Miami-Dade locations. There's Broward locations. There's West
Palm Beach, yeah.
locations. So the food drive basically is for those Medicare beneficiaries that are on Medicare. You're automatically going to qualify for a food distribution to get chicken, to get vegetables, to get, you know, these certain foods at zero cost if you affiliate yourself with, you know, this medical center. So basically that's what the food drive is. And, you know, guys, please come out, give us, you know.
Give us a call. If you're interested in those benefits, please give us a call again at 954-614-5488. You know, we'll give you those answers quick.
And one last thing, guys. If you guys have any questions and want us to talk about something specifically for the next show, call us. Say, hey, listen, give us an explanation on this, and we'll explain it. All
Definitely.
right, guys? We get paid through the insurance carrier. So this is hands-free for you guys. All you guys have to do is call, pick up the phone, ask us questions, and that's it.
Yeah, that's why we mentioned from the beginning, we don't charge anything. We get paid directly from the carrier, so we don't charge anything. It's free of cost.
Absolutely. Thank you guys so much for tagging along. And should we?
Give another minute.
We haven't. Well, I think we're pretty much done.
Yeah, we're pretty much done with this.
Yeah.
this
Why?
one.
Yeah. So.
Phone number again.
Phone number again, so if you need any questions, anything you guys need, listen, we're here to help. Please reach out to us. We'll answer our calls, and if we don't answer, we'll get back to you real quick.
And
call us at 954-614-5488.
And don't forget to call for the movies of Delray and movies of Lake Worth, okay? Get the opportunity to get 2 free tickets. It's really important, and it means a lot to these guys. They've been supporting us, and get a free chance to win.
All right. All right. See you next time. Thank you guys so much.
All righty. Bye-bye.
Thanks for watching the All-in-One Medicare Show. Tune in each week to learn about the best Medicare group to help with your Medicare plan needs. If you have any questions or would like to be on the show, call 954-614-5488 or go to allinOnebenefits.com. Let's resolve it all in one.